Hi, everybody. We are back with another episode of ANJC Sitdowns, and I'm thrilled to welcome my guest that should be no stranger to anybody that's been involved with the ANJC, Mr. Dave Klein. Thank you so much for being our guest today.
Thanks for having me. It's great to be
Yeah.
here.
So, as I said, this you should be no stranger to anybody that's been involved with the ANJC, as you're super visible and do so much for us on many different levels. But you really are such an important part of our team here as our coding consultant, and you're a generous sponsor. You write for the magazine and blogs. You present webinars. You're all over the place. Um, I can't imagine that people don't know who you are, but just in case, can you just share a little bit about yourself and what you do when you're not being our coding consultant?
Yeah, so I've got a couple things going. I started PDC, which is, of course, a electronic health records company that we're in 49 different states. So I work, all over the country
Wow.
working with providers, and it's a practice management software, billing software, collections, documentation, all that fun stuff. Um, and I also, as a coding compliance consultant, I've been doing that for close to 30 years. Prior to that, I was actually a perfusionist. I worked in cardiothoracic surgery.
Oh
And
boy.
I operated the heart and lung machine. Yeah.
Wow.
So I would go into someone needed bypass graft for their heart. I'd go in and run the machine that took over for the heart and lungs
Wow.
and did that for 5 years. It was, the call time got really tough. It was a lot of traveling from hospital to hospital, and I did 7 days on, 7 days off. And I got out and I knew, I decided, you know what, I want to do something different. So I went to a startup who did billing services, and they needed someone to help them bring on clients. And, I knew a lot of physicians
Yeah.
working in the industry. My brother-in-law was a DC out of California. So I was like, all right, well, I know a little bit about, we talked about chiropractic coding and so on. And so I started to sell different providers and a bunch of chiropractors that I knew. And we started to do billing services. The problem is that the billing company, they didn't know how to bill for the
Oh,
chiropractic services. I felt responsible. So I started studying and learned how to do coding and compliance. And then I worked for a 36 office clinic.
oh.
They start off at seven when I got, and by the time I left, they were at 36 offices, and I ran their billing department and coding. So that's kind of how I cut my teeth and got into the industry.
Wow. And now, in addition to PDC, what are the other? I know that you have a couple other companies.
So I have the compliance consulting firm that I do a lot of audit defense. So if providers are audited, I'll help defend. I work a lot with like Jeff Randolph and other attorneys from Medicare audits and like commercial payer audits. And then we have a billing service division where we do billing services for about 80% of our clients are DCs. We
Mhm.
have physical therapy services, pain management groups as well. And then, of course, we also have gotten into substance abuse clinics. So we do billing for about 9 facilities that do substance abuse as well. So,
Interesting.
yeah.
Well, okay, so that's like on your outside. So when you're here with your ANJC hat on,
Mhm.
what is it, and how do you help us here with when you're our coding consultant?
I think the main thing is just helping, working with the ANJC team at headquarters, fielding questions, coding questions, documentation questions, reimbursement questions, um, anything that I have experience with, or that, people on my team, I'll tap team members as well because
Yeah.
we do a lot of billing and things like that. So it's a lot of Q&A, obviously webinars and seminars,
Mhm.
things like that as well. So
Yeah. Okay. And I also know that you work with, a lot of national organizations, state associations, and chiropractors across the country. What do you think is the biggest challenge facing the
mm.
profession? And how are you and your team, like, what are you doing to help?
That's a really great question. I think that the biggest challenge right now that I am seeing is really about shrinking reimbursement for providers. And it's not just DCs, it's all providers.
Yeah.
Payers are really, it feels, and I try and keep a unbiased opinion, but it feels like payers are looking for ways to reduce payments to providers, to really, find ways where they can cut costs, and looking at the rules to use them to their advantage.
Hmm.
And so that's the biggest issue that I am seeing right now. And it's really frustrating. But it also is interesting because I think it presents a good challenge. And the challenge is, how can we come up with ways to combat that? And that's, I think, really important for the profession to think about. And it's not just the individual provider, you have to think collectively. It has to be, a united front to come up with ways that are going to benefit everybody. And it's tough, don't get me wrong. Payers got a lot more money than providers do.
They do, and they're making the rules.
Yes, and they are making a lot of the rules. However, there are ways I think that we can use those rules to our advantage. And some of the tools as well. Like, payers are using AI to affect
Hmm.
denials. One of the things that we're working really hard for, like at PDC, is to use AI to combat those denials. And
Smart.
and that's, it takes a little bit of time, takes a lot of money, unfortunately, but we just hired someone on that they are a AI data analyst specialist. So they're helping to come up with ways to help combat those denials. And it's a whole new position that we just
What,
brought on.
like, what an interesting career, right?
Yeah.
I mean, that's
Yeah.
and are you
I
seeing
agree.
it just because you work with, you have clients that are more, in addition to chiropractors, are you seeing this from the payers like across the board?
Yes, I definitely am. Definitely am. I think that a lot of it comes down to, the biggest area of denials that I see are diagnosis related denials.
Hmm.
Players are really dialing into the rules. Like, a lot of providers will put down symptoms as their diagnosis as opposed to definitive diagnoses. I see payers really starting to key in on that. I see frequency being a big issue in all disciplines. And then the office visits, payers are starting to think, oh, well, office visits are inclusive of other services you provide, when sometimes they are, but they use that to their advantage and then they apply it broadly, and providers get caught up in that. So
Yeah. And then don't know how to manage it. And that's why
it's
we're
very
lucky to have you
difficult.
on our team.
Yeah. And that's the toughest thing too, because it takes a lot of effort to appeal one claim.
Hmm.
Imagine you get 20 of them, it's like, well, I'm not even gonna bother. It's not worth it. You can't, it's too hard to do. And that goes against the providers, unfortunately.
Well, that is really good insight. So, um, you and I are both involved with Chiropractic Future Strategic Plan, which, for those who don't know, is a national grassroots organization that is working on better access, better reimbursement, and a brighter future for the chiropractic profession. Why did you get involved, and what are you finding most rewarding about being a part of the organization?
Well, just like I was saying, I think it really takes a united front to combat a lot of these issues. And um, the 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 committee that I'm really working on a lot is the Technology Consortium.
Hmm.
And what that does is allow, obviously, as one of the owners of a technology company, we also have a lot of data. And I think just like the payers use data to
Hmm.
affect denials, we can use data to combat those denials. And I think that's really super important for the industry, is not just taking one or two providers and saying, here's some examples. It's like, hey, we've got 15 years of data that we can use to show
Across the country.
across the country, all different states. And so, like, they have a data lake that we're contributing to, and we're providing some of that data, and then basically taking that data and using it to help, fight fire with fire. That's what you got to do. And, it takes a lot. It's a lot. It's very expensive. It's very time consuming. And I think it's a really critical effort that needs to happen. So,
And at least for me, being part of the organization, being able to tap into, people throughout the country and just sort of see like, what are the issues that you guys are you seeing this? Like, what are you learning from each other? Because there's a lot. Um, we think of it just like here in New Jersey, and these are the issues that we're having, whether it's, everything from finding new patients to reimbursement challenges. But what
yep.
can we learn from each other?
Exactly. Yeah,
Yeah,
and sharing, because there's other coders involved, there's other auditing people, there's other EHR companies involved. I mean, there's a lot of people, and yeah, you can, there's some healthy competition, but we still have the same goal in mind, is that to help the profession. And
yeah,
that's the critical thing. And if you're not sharing, then you're not going to be as successful, in my opinion. So
yes, I agree. So all right, this might be a really difficult one to because I happen to have some insight into the questions that you get, but what's the most frequently asked question you receive from clients and potential clients?
I think that the most common question is obviously around coding and reimbursement issues. And most of them are surrounding modifiers, proper modifier usage.
Mm,
Um, the 59 modifier, the 25 modifier, when is it appropriate? When is it not appropriate? And, we've done tons of webinars on it. We've
mhm.
done seminars on it live, and multiple times. Probably every year we do something on modifiers and proper usage. And some of the issue and the confusion comes from, the, the payers and the AMA and the coding, their opinions have kind of changed over time. And so, they're moving the cheese, and you got to kind of follow that to see where it's going. And so providers often are relying on old resources, stuff that they learned, either hand me down, old coding books and things like that. And, so the best advice that I can give people is, stay on top of the rules. I know there's a lot of them, but those rules, the guidelines, they're all adopted as federal law. And so if you don't know what the law says when you're using these codes, or if you're relying on someone who told you something. So if you understand that and how they are, and stay up to date, and it's not just modifiers on the diagnosis codes and
Yeah.
CPT codes and all of that, I think most providers are going to be better off. But yes, definitely the modifiers is the most frequently asked question and issue that I run into.
I sort of knew that you were going to answer that way because I happen to be the gatekeeper for a lot of those questions.
Yeah.
And I have to say, like, take this opportunity to share that you you provide, like you said, webinars and articles in the magazine, blog posts, and they are all on the ANJC website. So there's a wealth of knowledge that Dave has very graciously shared with our members, and it is available. So please seek it out. He usually writes, at almost every magazine issue is Dave is featured in, if
Mm.
not, 3 out of 4, but articles, issues a year. But um, and if you have questions, like come to us. If you're experiencing, like come to us. The great thing that I think our team here is to try and identify when issues are going to be affecting others and say, let's put this out. And Dave is really helpful in saying like, oh, this is something that like we got to tell people and like start like educating. So um we're only as we need our members to reach out to us and share what's
Yeah.
going on so that we can then help colleagues. Um, Thank you. It's a pleasure working with you each and every day. And
Oh,
I
I
got to,
enjoy it.
after all these years, 3 years, I learned a little bit more about Dave Klein. I love that.
Well, look, I really love working with the ANJC and all the members, and it's been doing it for I think 17 years now. It's
Wow.
been a long time. So it's been super fun. It's look, it taught me a ton as well. Like I learn a lot myself and I really appreciate the opportunity to work with you and the entire membership. So it's fantastic.
Well, thank you. And thank you for taking time out to be our guest here on the
Thanks for having
ANJC
me.
Sit Down. All right. Thanks,
All right.
Dave.